Hello everyone, welcome back to my YouTube channel. It's your favorite next door midwife here again. If you are seeing my face for the first time, you're highly welcome. My name is Bamiwe Damlola. I'm a registered nurse and midwife based in Nigeria. Please kindly subscribe to my YouTube channel and don't forget to click the notification bell so you get notification anytime I post new videos. If you're a returning subscriber, thank you for always coming back to watch my videos. So today we'll be talking about 10 things you should not do while pregnant, which might have adverse effect on you as the mother or on the baby. So without further ado, let's dive right into the video. The number one thing you should not do while pregnant is do not take alcohol. If you are trying to get pregnant or at any point you feel you might be pregnant, please stop taking alcohol. Don't take it at all. The reason why you shouldn't take alcohol while pregnant is alcohol, when taken by the mother, it crosses the placenta barrier and it enters the bloodstream of the baby. And the liver of the baby is still so immature to break down alcohol. Then when alcohol is taken at the first trimester of pregnancy, it leads to fetal alcohol syndrome, which leads to growth retardation while the baby is still in utero. Then there's facial abnormalities, and then the alcohol taken during the first trimester can lead to learning difficulties later in life for the baby. So this is why please don't take alcohol. The number two thing you should not do while pregnant is do not lie on your back or on your chest while pregnant. The correct position to lie while pregnant is on your left side. Lie on your left side while sleeping. This helps to prevent hypertension. So please endeavor to always lie on your left side while pregnant, especially when the pregnancy is progressing. Please, it can lead to hypertension with adverse effects on the baby and even on the mother. So please try and always lie on your left side. I know it might not be comfortable, but please, for the sake of yourself and your baby, your health in general, please try and lie on your left side. The third thing is don't fast while pregnant. Please avoid fasting by all means. If your faith supports fasting, you feel like if you have not fasted, prayer might not be answered. Please, for the sake of your baby, don't fast. Or if you want to fast, you can fast from like early in the morning to 9 a.m. and then pray and eat. Please, I want you to know something today, that when you are pregnant, every action you take has effect on your baby. Now you're not thinking of yourself alone, you're also thinking of the health of your baby. For the sake of your baby, don't fast, because there are certain daily requirements of nutrients you need to meet as a pregnant mom, for healthy baby and for your health. Then if you are fasting regularly, you might not meet this daily requirement. That is why it is very important that you don't fast and you eat healthy. So the number four thing you should not do while pregnant is do not smoke. Don't smoke at all. Do not smoke as a mother, and don't be a secondary smoker. A secondary smoker means that you are inhaling the smoke from another person's cigarette or substance. So please avoid it by all means. The reason behind this is that there is a toxic chemical that is usually emitted from smoke, which is carbon monoxide. This carbon monoxide, when it's inhaled by a pregnant mom, it crosses the placenta and it enters into the bloodstream of the baby. And what it does is that it limits the oxygen supply of the baby, which can lead to fetal death. When it is continuous, it can lead to fetal death, and it can also lead to retarded growth, intrauterine growth retardation in the baby, which you don't want at all. And it can also lead to asthma in the later life of the baby. When you giving birth to the baby, healthy baby, then later in life the baby just comes down with asthma. It might be due to the smoke you inhaled from cigarette and other substances while pregnant. So I want to advise us today, when you are going out and you know that you'll be passing places where smokers live and they smoke, make sure you go with your face mask. Always go with your face mask so that you will prevent yourself from inhaling smoke from secondary smoker, or if you are traveling and you will be using a public transportation means, make sure that you have your mask, because where you are boarding, some smokers might be there and they will be smoking. Then if you are not with your face mask, inhaling the smoke is inevitable, but you can prevent it by using your face mask. This will help to prevent smoke, carbon monoxide and whatnot, to getting to your baby, which have adverse effect on your baby. The number 5 thing you should not do while pregnancy: do not take over the counter medication while pregnant. If you are the type of person that immediately you feel symptoms of malaria or headache, you walk into the nearest pharmacy store and you buy your medication, please, while pregnant, don't do this, because there are certain medications that have adverse effects on pregnant moms and even on their baby, especially anti-malaria and antibiotics. Please don't prescribe these medications by yourself. Immediately you are pregnant, any symptoms you feel, please go to your doctor for proper prescription. And if your pregnancy is still yet to be obvious and you go into the hospital to see a doctor, please make sure to tell the doctor that you are pregnant, so that the doctor will put your pregnancy into consideration when prescribing medications for you. So please don't just meditate at all when you are pregnant, because apart from having an adverse effect on the baby while still in utero, it might have adverse effect on the baby when the baby starts growing up. So please don't just meditate while pregnant. The number 6 thing you should not do while pregnant is do not miss your medications. The medications prescribed to you during antenatal visits, please, they are very, very important. I understand that they might be nauseating sometimes, like the smell of some of them might be very nauseating, but you need to take them, especially your folic acid supplement. Please take it with all seriousness, because folic acid deficiency in pregnant mom leads to neural tube defect in the baby, and the very common type of neural tube defect we see in the part of the world is spinal bifida, and I bet you don't want to see it in your baby. It is not nice at all. So please take your folic acid supplement. If you know that it makes you nauseous, take it with water. If you know taking it with water will reduce the the nauseating effect, take it with water. If you know taking it with tea or juice will reduce the nauseating effect, please go ahead and take it with them. And if you know taking it while eating, then eating after using it will help to reduce the nauseating effect. Please do it. Anything that works for you, please do it, but just ensure that you take the medications as prescribed, so that it will help to keep your baby in perfect health. It is recommended that the daily requirements of folic acid you need as a pregnant mom should be met from the food you eat daily. But to just prevent any form of complication, it is advisable to still take folic acid supplement. So please don't give an excuse, just use your medication as prescribed by your doctor. The number 7 thing you shouldn't do is don't involve in strenuous exercise. Moderate and mild exercise is very important while pregnant. It helps to prepare you for birth, and it also helps to reduce sedentary lifestyle. But don't involve in strenuous exercise. Exercise like jumping rope, skipping rope, exercise that might lead to physical injury or trauma to both you and the baby, please don't involve in it. Exercise that can increase your risk of falling down, please don't involve in it. It can be very, very dangerous to your health and the health of your baby. So please involve in only mild exercise and moderate exercise. Even your house chores, cleaning the house, washing of dishes, is enough exercise for you as a pregnant mom. Number 8 is do not miss your vaccination. The particular vaccination for pregnant mom is tetanus toxoid vaccination. This is very important during pregnancy. Even if you've completed your required dose of tetanus toxoid vaccination before pregnancy, it will not cause you harm if you take booster shots while pregnant. Please, when your doctors ask you about your vaccination, especially for the tetanus toxoid, tell them you want to take booster shot. And if you've not taken any dose of tetanus toxoid before your pregnancy, ensure that you commence the vaccination while pregnant. After the first dose, you have 1 month before the second dose, then 6 months before the third dose. So if you are taking the normal regimen of tetanus toxoid vaccination while pregnant, it is recommended that you would have taken 3 doses of tetanus toxoid vaccine before you put to bed. This tetanus toxoid vaccine helps to prevent tetanus infection during delivery, and it is very, very important because tetanus infection can be very, very dangerous, and it has high mortality rate. Number 9 thing you shouldn't do is avoid wearing heels. I know that some people might be like, heels, I wear heels every day, but please, when you are pregnant, just try to minimize the heels you wear, especially if you are a working class mom and you always want to look smart to work, regardless of being pregnant or not. Please minimize the rate at which you wear heels. The reason for this is that there's an hormone known as relaxin. This relaxin hormone works on the pelvic joint by relaxing the pelvic joint, and it also relaxes the pelvic ligament, which makes them loose and very fragile during pregnancy. And with this action, it comes with backache. You start feeling backache, and your gait and posture becomes unstable. And this unstable gait increases the risk of falling. And if you put on heels, it helps to triple the risk of falling. So that is why I'm advising that you should not put on heels. If you feel that you need to wear heels, you can get block heels. Block heels will still make you look smart, so that it will help to distribute your weight and reduce the risk of falling, so that you'll be fine. Falling while pregnant is a very scary incident that you don't want to go through. So you can just substitute your heels for block heels for the meantime while you are pregnant. Then when you put to bed, you can resume your heels. The number 10 and the last thing you shouldn't do for this video is that don't try to lose weight while pregnant. There is a recommended weight that a pregnant mom should gain while pregnant. So it is normal for you to gain weight when you are pregnant. So if you feel like you are gaining weight while pregnant, please, it is normal. So far you are eating healthy and you are not overeating while pregnant. The weight you are gaining is very important for you and the baby. So don't try to lose weight. Don't try to go on 90-day challenge. Don't try to go on water fasting. Don't try to go on intermittent fasting while pregnant. Please, when you deliver the baby healthy, you also healthy, then you can go ahead and start snatching the waist and snatching the body. So, but while pregnant, please avoid trying to lose weight. By all means, what I can say is that eat healthy, eat nutritious meals, but don't try and lose weight. When you give birth, when you put to bed, then you can put in all measures to come back to shape. So this has brought us to the end of this video. I hope you learned a thing or two. Please, if you did, don't forget to like, comment. I really love to see your comments. Don't forget to also share this video. And please, if you watch up to this moment and you've not subscribed, please kindly subscribe to my YouTube channel, and don't forget to click the notification bell so you get notification anytime I post new videos. I remain your favorite next door midwife. Don't forget, on this channel our goal is healthy baby, healthy mother. Till I come away next time, please stay safe, and I love you all so much. Bye.